Hey, Professor Sokol, it's Taylor for my female catheterization checkoff. I'm going to knock on the door. Hi, my name is Taylor. I'm going to be your student nurse for today. The doctor has ordered for an insertion of a Foley to help you urinate. I'm going to be placing that today. It's going to take about 10 minutes or so. Is that going to be okay? Okay, perfect. Can you verify your name and date of birth for me? Awesome. And are you having any pain today? Okay. And any allergies? Okay, perfect. So let's go ahead and get you cleaned up here. I'm going to make sure that you're laying comfortably on this drape pad. The peri area is clean. Have you undress. Okay. Now I'm going to have you bend your legs. And go ahead and just keep your heels together as tolerated, okay? I'm going to set up my all my stuff over here. I'm going to remove my gloves. My patient is clean and comfortable. I'm going to perform hand hygiene. All right, I have my Foley kit here. Remove that. Don't open. Okay. Okay. First. Okay. Place my trash bag here. Normally I'd put it at the other end, but I didn't want it to block the camera. So here we go. Keeping the 1-inch margins. Okay, perfect. I'm going to first grab my drape. Now the patient's bed is going to be waist height with me, so it's going to be a little higher than right now. I just don't have the ability to raise the bed. I'm going to put shiny side down in between the patient's legs. I have my sterile gloves, which I'll grab. Okay, perfect. So my sterile gloves are on. I'm going to take this and go around my sterile field and place it in my trash area here. I'm going to go through my kit. I have the finasterated drape, which I don't need. We'll place in the trash. My specimen collection cup, which I don't need. I will toss in the trash. Now I have my iodine solution. I'm going to go ahead and tear this open. And I'm going to make sure all of my cotton balls are soaked. It's going to be nice and orange. And I will toss that. Let me see here. I have my lube, which I will open and squirt into the tray here. Toss that. And let's get the other stuff ready. So I'm going to grab from the center here. I have my water. This is going to be to inflate my balloon on my Foley. Now let's pretend that the blue shield is on here, the lining. So I'm going to grab from the base and go ahead and pull it off while I'm keeping tight control of the catheter line. So there we go. I'm going to remove the water plug and place it on the port for my balloon to be ready when I am. Should not do that. Okay. And so now I have all of my supplies ready. We'll go ahead and put this back in here. And now we are ready to move this to the patient. I'll go here. So all of my supplies are facing the perineum. Now I'm going to take my left hand, which is my non-dominant hand, and I'm going to place it on the labia to spread it. Grab one cotton ball at a time. We're going to go on the left side of the labia, top to bottom, and toss. Next cotton ball, top to bottom on the other side of the labia, and toss. And last one, we're going to go top to bottom, straight down the middle, and toss, along with the pinching applicator. I'm going to grab this and the end of my Foley. So I am going to dip this in the applicator. I've got a firm grip on it. Dip it in the lubricant. So I am going to go straight into the urethra. This gloved hand is not going to be touching the perineum at all. And I'm going to advance and instruct the patient to bear down as I am doing this until I get urine flashback, which I do. So I'm going to take this left hand and hold on to the line there. I'm going to use my dominant hand to inflate the balloon. Perfect. So the balloon is inflated. My hand is staying on the plunger. Now that the balloon is inflated, I can remove this left hand to assist my right hand in removing the syringe. Now that the catheter is in, the balloon is inflated, I am done being sterile. I'm going to start cleaning my mess and get this catheter bag out. So the Foley bag, the hook will hook onto the edge of the bed, and I will secure this either with a stat lock or some kind of Velcro to the upper inner thigh. That way it's not going to allow tugging of the area and make it uncomfortable for the patient. Get rid of my stuff here. Return the patient to a comfortable position. And now I can go ahead and document on the procedure how the patient tolerated it, and I will also note the type of drainage that's coming from the Foley bag. The patient tolerated it well. I will go ahead and lower the bed again, clean up my mess, and ask the patient if there's anything else I can do for them at this time.